Dr. C is currently designated as the Associate Professor of Health Professions Education at the National Teacher Training Center for Health Professions, University of the Philippines, Manila. In UP Manila, he teaches courses on instructional designs, learning theories, interprofessional education, and collaborative practice and teaching skills. On top of that, he is a strong advocate of occupational justice and had done a lot of researches on occupational justice health questionnaire. So without further ado, I present to you the floor, Dr. Michael C. for workshop entitled Occupational Justice in the LGBT Community. Sir Mike?
Thank you so much, Charlie, for that introduction. And I put in the chat box, I welcome everyone in this session. And I'd like you to just put in the chat box your nickname, your professional background. If you are a student, please inform me about that and where you are affiliated. Thank you. Just so I would try to tailor fit my session based on your backgrounds as well. Okay, so let me begin. If this is a short training session, which will be done in an hour, and the training objectives for us is first to discuss the intersections of occupational justice, healthcare access, and LGBT citizens. And then the bulk of this session will be to introduce to you the Occupational Justice Health Questionnaire as a viable tool in OT and justice work, not only occupational therapy, but also justice work in health or in the social care settings to generate more inclusive interventions and also assessments in your practice. And towards the end, we hope to foster an open dialogue about the positionality of OTs and justice workers on LGBT care. Okay. Before I begin, just a disclaimer. The views and comments, as well as recommendations expressed by the facilitator are my own, and they do not necessarily reflect the views of the conference organizers, the CGWS, UP Manila, and other affiliations that I have. If you feel that your views are different to what is being discussed in this presentation and workshop, you may express yourselves in the question and answer portion. And of course, participants of the workshop are expected to communicate in a respectful, courteous, and professional manner. I believe that I am also a learner here and that you are also my teachers in this session. I want to introduce this session by informing you about occupational therapy. So I have seen here that there are sociologists who are attending from different institutions, and you may probably be working in other settings. Hannah is from the UK, and she's an occupational therapist. I hope we can also, the others can also chat their affiliation. Okay, there's a nurse. Thank you. So occupational therapy, at least in my worldview, is a justice-oriented profession. For us as an occupational therapist, occupation is a vital concept, and we consider occupation as a determinant of health, well-being, and justice. When you say occupation, we mean activities of daily living. As you can see on the pictures here in the slide, these are occupations: eating, watering your plants, playing, or engaging in leisure activities. The OT profession is fundamentally purposed to address injustices, to facilitate occupational participation and justice. Meaning to say, aside from providing clients how to go back to their previous activities after an injury, after a health condition or disease, occupational therapists are being positioned where we can or we have to help people participate in daily activities, especially when they're facing political, social, and economic challenges. Occupational justice came from the conceptualizations among occupational therapy scholars. For them, OJ, or occupational justice, is a powerful concept. If you read in the literature, occupational justice is quite related to social justice. They have intersections, but they are not the same. They have differences. So according to Wilcock and Townsend, occupational justice highlights people as occupational beings who can achieve health by living in a just society where they can have diverse opportunities and equitable resources towards occupational participation in varied contexts. However, this concept, occupational justice, still remains to be ambiguous to many occupational therapists, more so to many healthcare professionals. Just a quick story for all of you. Whenever we talk about occupational justice, whether in conferences or presentations, many people feel confused about what we're talking about. And some people even question us if occupational justice is even achievable. Occupational justice, in a nutshell, means the right to participate and fair participation. I believe that this concept is hard to grasp because we see a lot of injustices around us, especially in the Philippines, where injustices seems to be a normal thing in everyday life. There are several frameworks on occupational justice. And I believe that these kinds of frameworks and theories are not limited to occupational therapists. I have seen in the literature that occupational justice are now being used in other fields such as psychology and other related disciplines. So as you can see here, the framework of occupational justice, which was conceptualized by Elizabeth Townsend and Helene Polatayco in 2013, you can see here that there are a lot of factors affecting human participation. And we can never be simplistic when we see how humans participate, more so citizens from the LGBT community. We might see how that they are participating in many activities, but citizens from the LGBT community may have underlying reasons why they cannot participate in such activities that they need or that they find meaningful. So when you look at this, there are structural factors that we need to consider, contextual factors. At the same time, there is also a need to recognize the injustices that they experience. So we can provide interventions, we can provide help, and even just support for them on how to navigate in their daily activities. Another framework is called the Participatory Occupational Justice Framework by Gail Whitford and Elizabeth Townsend. This framework was conceptualized in 2010. And as you can see, it aims to promote social inclusion and change by raising the awareness of and addressing occupational injustices. There are 6 circles called the key enablement skills, and they are seen as non-linear when it comes to the flow. So it's not like step 1, 2, and 3, 4, 5, and 6. The enablement skill can be done from anywhere. But they suggest that in order for us to achieve occupational justice in any community or in any population, we can start by raising the consciousness of occupational injustices. So that's the first thing that we may need to recognize. And then we go around until we reach an inspired advocacy or a closure of a certain program for a certain population that we're helping. Now, what are the outcomes of occupational justice? The outcomes are called occupational rights, human rights. But occupational rights focuses on how people will have a fair right to participate. So as you can see here, the first right could be the right to exert individual and population autonomy through choice in occupations. Being able to choose what they want to do is very important to people. If that does not happen, there is marginalization. The right to develop through participation in occupations for health and social inclusion. The right to benefit from fair privileges for diverse participation in occupation. And the right to experience occupation as meaningful and enriching. This may look very conceptual when we just read it, but once we start talking to people who are being marginalized, my experience was when I was doing research in the drug rehabilitation. When you start hearing their stories and having a conversation with them, you will see how concrete these rights are and how they are being violated in everyday life. I believe that most of you are already aware and knowledgeable about the difference between sex and gender. And I think that we need to continue talking about it, like what the keynote speech yesterday told us, and even the panel discussions. It's not about knowing the right term or the wrong term. It's just about really continuing the conversation about gender and about sex. Because as we know, the understanding of sex and gender varies from country to country, and whatever it is that's or how gender and sex are defined in a Western country, for example, may not readily be understood in a conservative country like the Philippines. I don't have an exhaustive list of how injustices are being experienced by citizens from the LGBT community. But as you can see here in this list, we can see that many of them, many of them have experienced injustices. And these injustices can specifically include occupational injustices. So the ability to get married, same-sex union is only granted in 30 countries. The Philippines, apparently until today, we still do not have that. That's not part of the law yet. It hasn't been passed. Homosexual activities between consenting adults remain illegal in many countries. Members of the LGBT community continue to experience this discrimination, violence, and exclusion from society. I think every week we hear news from social media, and I think that's very alarming. There's consistent documentation of high levels of discrimination at work. I have encountered that myself when I was interviewing people who are part of the LGBT, and for us, many of us, we find employment as part of our life trajectory. But for many of them, for many of us, it's difficult. More than 70% of the LGBT community received insufficient service in businesses, including healthcare, most importantly, healthcare, and many other situations where the LGBT citizens are being marginalized. I already mentioned that the legalization of same-sex marriage has not been passed yet in the Philippines, and that is attributed to the adherence of Filipinos to the family code, the Catholic faith, and conservative views. But there are people already who are lobbying it. And as you can see, Geraldine Roman, the one on the picture, is the first transgender person to be elected to the Philippine Congress. And I think she's one of the advocates of these laws and many other related legislations to foreground the rights of citizens from the LGBT community. I'm sure that you are aware. Some of you might be aware of these current events. For example, in CNN Philippines, there was this survey finding that Filipino companies are not accepting LGBTQ citizens. And I think in 2019, it was all in our headlines where a transgendered woman was discriminated by using a restroom. And that sparked dialogues and conversations in the society, in our society. And I believe that there are pluralistic views and opinions about these issues. Even people from the LGBT communities have differing views. And I think we should continue talking about that so we can find a viable solution and foster conversations rather than mere conflicts in the future. In other news, you can see that the global HIV response found to neglect gay and bisexual men, even trans women, especially in accessing healthcare. And in terms of mental health, we can see that there is a rise in terms of suicide risks among teenagers who associate themselves to the LGBTQ community. Another thing that I'd like to highlight is that there is a shortage of healthcare providers who are knowledgeable and culturally competent in working with LGBT citizens in health services. Most people in the Philippines who are aware of the LGBT citizens' needs in terms of health may be advocates or researchers or people in the academe. But health workers who are knowledgeable and capable of helping citizens from the LGBT community are still lacking. And yesterday, during the panel discussion, I learned that to be an ally, we have to first understand our own beliefs and see if we are the best person to help people from the LGBTQ community. If not, we can always refer and find someone who can understand LGBT citizens better, so we can provide the best possible and the high quality healthcare that they deserve as the same as the others. Now, having that background, I think the purpose of this short workshop is really to not necessarily apply, but really to understand what occupational justice is and how we can use it in our own practices. According to Hawking and Townsend, there are several populations where we can use the occupational justice lens. And these include people with disabilities, people who are homeless, immigrants, women who are barred from preferred occupations, and populations dealing with the following underlying social structures, such as ableism, ageism, colonialism, heterosexism, poverty, racism, and even sexism. Now, I'd like to introduce to you the OJHQ, or the Occupational Justice Health Questionnaire. If you are a master's student, a PhD student, a practitioner, you might want to take a look at this so you can use this either for your research or your practice. The original purpose of the OJHQ is to prompt attention to occupational justice in a busy practice day, and to provide a starting point to document injustice and encourage action. Basically, what the OJHQ wants is to really raise the voices of those who are being silenced, especially in the healthcare setting. This tool has been adapted and translated into the Filipino language by me and my colleagues, including Charlie. OJHQ was a tool that I used for my PhD dissertation. The tool has 5 parts and it has 27 items. As you can see, it's quite basic. You have the demographics. Part 1 part 1 has basic needs information. Part 2 is about overall well-being. Part 3 and 4 are living standards. And part 5, which is the most important, is identifying specific injustices that decrease participation in everyday life. The last part is a box where we can put our recommendations and viable actions to help people who are being injustice. This is a photo, a scanned photo from our textbook, from a textbook, Willard and Spackman. And this is how it looks like in one page. But I will give you you can navigate a copy of this in a while. So this is how it looks like. Each item is answerable through binary options. So for example, you wanted to ask about the basic needs of the person or a group of people. So you can use this to interview as an interview tool for a group of people or just a person or a population. So for example, we can choose the item shelter. Are you able to have shelter or find shelter? They can answer able or unable. If it's unable, we don't have any shelter, if that's what the individual answers you, then you need to identify why are they unable to achieve or to have a shelter. So you may categorize it to health reasons, political, social, and even economic reasons. Towards the end column, you can see a comment box where you can annotate the reasons as to why this individual or group cannot access shelter, education, food, income, etc. We have prepared an interview guide that can help practitioners use this as an interview tool, and it's also available in our resource site, which we will be sharing with you in a while. So I'd like to invite, how many are we? I'd like to invite the 12 people who are here this evening. Thank you so much for staying. To go to this resource site, you can type in tinyurl.com ojhq/ojhq site. So I will also help you navigate in a while. I'll just stop share and then I'll show you our site. So we will walk through together. Charlie, can you please type in the chat box the resource site so they can just click? Sorry, are you there? Thank you. There you go. Thank you so much. So you can go here and then I'll just share again. So once you click that link, you will be brought to this very simple resource site. So the purpose of the website is there. Basically, it's a free site for everyone. The background, which I mentioned already, research and scholarship. So currently, we have around more than 5 research about this using the OJHQ, and we have ongoing studies in OJHQ. There are 3. And so these are some of the uses of OJHQ. And if you have any feedback for us, you can just click this. And we also have an appendix of definition of terms for the constructs included in the OJHQ. So shelter, we have defined that and we have created a glossary for all of you. If you go to the other tabs, you can click here and have a copy of the original version. We also have the English version and the Filipino version. We are also developing the Google Form version, which is just based on the original version. So you can use that. And we also have here a space for our recent dissemination activity. So one of that is the Global Assembly on Everyday Life, Gender, and Sexuality. And we have presented this in several conferences. We also presented this in several universities and organizations in the DOH, OT community, and other universities. So here are some of our research publications, and you can just access that through this URL. And we have a contact us page. So if you have queries, inquiries on the OJHQ, you can just keep in touch with us. Now I want to go back to my presentation. So for our short workshop, we still have time, I guess. We have 15 to 20 minutes for this. And the tasks for us here is to recall a recent LGBT-related issue in your own country or practice which is attributed to discrimination in terms of everyday living and participation. So how do you answer this or help you answer or help us in our dialogue? Looking at the OJHQ resource site, so you already have the website, you can check on the OJHQ as a tool. And I want you to share with us, how do you think its applicability will be in your own practice or in your own profession? I'm happy that we have participants from different professions. What do you think is unique with the OJHQ as a tool or practice in health client care? And what could be the challenge or challenges when you use this tool? So I hope to give you 3 to 5 minutes to navigate the site and the OJHQ. So around 3 to 5 minutes, and then we'll open our forum for some sharing or open dialogue. Okay, I will stop share and then share the site, so we will be all in one page. Okay, wait a moment. All right. So this is the original version. You can just take a look. Okay, so you can continue navigating the site and the tool in itself. Now, I'm opening the floor for everyone who'd like to share their thoughts on this and maybe share some experience that you have encountered when you are seeing clients, or maybe you've experienced this yourself as an LGBT citizen, or as a relative or a friend of somebody from the LGBT community experiencing discrimination. Anyone? I think people are so quiet in this workshop. I hope maybe anyone can share your thoughts on this, because this will really help our research group to continue our work on this area. And we will be happy, very happy to hear your thoughts. Anyone?
Oh, I can't have the silence.
Hi, Hannah.
Hello. So I'm not familiar with the Occupational Justice Health Questionnaire, but just seeing the prompts there, and thinking about particularly the lives of trans people and how trans identity, is impacted on every aspect of occupational life is impacted on by trans identity, in terms of barriers to all types of patterns of doing and internalized sense of transphobia as well. I just wanted to start the discussion and be the brave one.
Thank you for starting the conversation. Yeah, can you so you mentioned that you're an occupational therapist, and have you met people in the UK who are struggling to participate because of their identity?
I've met people, and also it's well evidenced in the literature as well, in terms of trans people avoiding accessing healthcare for fear of discrimination.
Yeah.
So I think, you know, when you think of health and access to healthcare as a fundamental human right, like it kind of, if we think of those traditional categories of occupation of self-care, productivity, leisure, but kind of beyond that as a fundamental human right, people are experiencing kind of barriers to accessing that, and I've heard people's attitudes as well, unfortunately.
Oh yeah, you're correct. I believe that that's not only particularly happening in the UK, but more so in other parts of the world, especially here in the Philippines, where many people, even, you know, for people with disabilities, as simple as it's not a simple, it's not a simple phenomenon. It's a complex phenomenon. But for even for people with disabilities, many people don't know how to, you know, even transfer them from the car or the taxi cab to a wheelchair. So they are not given access to commute or to use public transportation, for that matter. What more for people who have, you know, a different gender identity that is different from everyone else. And it's good that you mentioned about it's not that they are not given healthcare, but they don't want to access healthcare anymore because of a certain trauma in the past, or they are just fearful that they will be discriminated anyway, even if they have the access or even the money to access this healthcare. Yeah, that's a very important discussion that we may talk about. Maybe the others have thoughts on what Hannah started for us. Anyone from the group? We're only 8, and I believe this intimate group can have a rich conversation. I saw who's the nurse from the group? I saw one. Maybe Mark Angelo. Oh,
Hello.
there are many Marks here. Mark Angelo and Mark Oliver. Maybe you can share your experience in terms of healthcare access.
Okay,
Yeah.
hello, good evening, everyone.
Yes.
My name is Mark, and I'm from Davao City.
Yeah.
With regards to this topic, actually, sir, I just read the tool itself. Actually, I think in my perspective, in my experience so far, sir, in the healthcare setting, actually as a nurse, I didn't actually experience much discrimination in the workplace, because I think some of the people are already open-minded. But I think I think it would be better if we could do some assessment, perhaps in a population, like a wider scale, perhaps in the administrative side, like those in the offices, or those with the other in with the allied services, perhaps, or even with the doctors, to gauge further, to assess further to what extent could be there, if there's discrimination, or does discrimination exist or not. And I think also, as a nurse also, I think based of my actually, I find it very interesting to know about this one, because I think as a nurse, we should be self-aware of our culture, of our especially our background, in terms of like prior to handling patients, because we do not know if it could affect our care provisions of care that we'll be providing to our patients or not. So thus, it is also important for us to be self-aware prior to providing patient care so that we could adjust or we could somehow do without it, do something about it in order for us to be effective healthcare workers. So that's my take, sir. Thank you.
Thank you, Mark. I agree that there has to be somehow a mapping of the extent of discrimination or injustices being experienced in a bigger scale, maybe in an institution or in a community. But of course, I would hypothesize that there is discrimination, there is discrimination happening, but the question there is, what are we doing? What are the things that we can do, actionable activities that we can do so that we can reduce this fear of getting healthcare access, etc. Thank you, Mark, for your sharing.
Thank you so
Anyone
much.
else would like to share? Yes. Is that the other Mark who wants to
Yes, it's
speak? Oh,
the
Mark,
other.
yes, go.
But you can call me Mo. Hello.
Mo, hello.
I'm
Mo.
from UP Los Baños. Just some ideas about the questionnaire. I think it's a fantastic tool that other social scientists or health allied professionals can start working on or using in their own practice. So that's my initial idea, and then. I understand you've already translated this into Filipino. So I'm just wondering if you've already started translating this into other Philippine languages, so that might also be helpful. And I started looking at the Filipino translation. I'm just thinking with about the whole idea of using westernized tools, no, and trying to apply it in local context. Of course, there is some value in using this, you know, but so for example, I think that has already been a long-standing comment among global South scholars, no, the appropriateness of Western tools in local realities. And we also have the same comment from, say, for example, from Filipino psychology. And I'm also wondering, so for example, if we started using this questionnaire, I'm just trying to pick things here. I don't know whether or not that's going to be helpful later on. So for example, if we ask them about, sorry, I'm looking at the the questionnaire, so I'm moving my head. So if we start asking them about whether or not there have been opportunities to participate in the arts, so I'm thinking whether that is actually a value for us Filipinos, no? So for example, I'm sure Hannah would for people in the UK, it's really important that workers have holidays, right? So, but in the Philippines, we don't normally talk about holidays. We would rather choose to work because we would need the money. But for the British people, it's important that sometimes they would regularly have holidays elsewhere, preferably outside the UK. So yeah, those are just my initial comments. And also, just one last point. I think this would also be useful in using alongside other tools. So for example, if we begin to think about intersectionality, so the gender identity is just the starting point, but discrimination is also a class issue. This could also be linked towards other identities that we assume as individuals. So I don't know what you think about it. Thank you.
Thank you. Thank you so much, Mo, for that comprehensive comments and thoughts. I now started to forget your first question. Your first question was about where are we able to translate it in other Philippine languages? Not yet. we just have it translated from the Sentro ng Wikang Filipino ng UP Manila into that Filipino language based in Tagalog, because we're all starting this. It's just we're just starting using that. In fact, when I asked permission from Professor Elizabeth Townsend, she just said, no one has used it yet. Maybe you want to start using it in the Philippines and tell us what you think about it. So that's one. And then your next question is the perspective of global South scholars when it comes to using westernized tools. That is an issue at the very beginning when we started using this. And that's why after using it for a phenomenological research in the drug addiction setting, we started using that in that setting. And we decided to do some field notes and reflection notes while we were using the tool, because we felt like the arts and the scientific advancement items are really not applicable to the Filipino. And I agree that in one of our quotations that we got from the participants, they said that, what is leisure? I don't understand what vacation means. And that's it. It really informed us as researchers, like, oh yeah, okay. So we find we understand rest differently here. So that's why we published a paper on the reflections on how we use this. It just got published this year, and we criticized how we used it, and we criticized the tool in itself from a Filipino perspective. Like, okay, there are items here that may need to be removed. So one of our recommendations, I'll share that with you, Mo. I'll share you the copy, because we also provided like recommendations on, if you're going to use it for the LGBT or in any population, you can actually adapt it, because there are items that are not really applicable. I agree with you on that. And we have been getting emails from different disciplines, which is surprising. There are psychology students who ask us for the copy of the questionnaire to use it. And we were so thrilled, because, okay, so they are going to use it for intersections in disciplines, and especially for sociology. And I believe that the tool is still being developed at this point. And maybe if you will translate it in other Philippine languages, there are people from South America who wanted to translate this in Spanish, and some people from Vienna, from Austria, who would like to translate this in German. And I said, why not? I mean, this is not mine anyway. We just translated it, so just do it. And I think this will really spark conversation and will really make us think as Filipino researchers, practitioners, health workers, to really think through what is the meaning of justice even for us. And just want to share with you one of the main findings that we got from our reflective study is that injustices evolve, they mutate. So if we put people in other places, like for example, those people who are sent to the drug rehabilitation centers, they might be experiencing injustices outside, but once they get in, there are other types of injustices that they get to experience. Because our hypothesis before is when they get to the drug rehabilitation center, injustices will be removed. Apparently, it's not. Apparently, it just changes and mutates. And when they get out, there's another wave of discrimination that they need to face because of their past and histories. Thank you so much, Mo, for that. That really sparked this conversation.
And another thing, in terms of using it in actual context, so I was also thinking, again, I was looking at the Filipino translation. Actually, I've downloaded the 2021 article. I just wasn't able to finish reading it. But I was just thinking, so for example, and I know that the translation process, you followed certain procedures in that. But now looking at the Filipino questionnaire, I wonder whether it will also be useful if, for example, we will insert our o and opo, because interactionally when we are talking to each other, especially to our, I don't know how you refer it in your discipline, to your clients, diba? Or to your participants. Even I call them participants because I'm a sociologist. we would always want to be magalang or polite.
Yeah.
So po and opo is always inserted in our statements, and that in a way interactionally helps us really think about and process how we think about our own experience. So yun lang.
Thank you. That's noted. We will take note of that. So when we have other people use this and when we use it again, we will integrate that in our script in our interview guide. Thank you. Thank you, Mo. There's a comment from Mark Angelo. This topic is very interesting. I might consider it as a topic for my nursing dissertation. Thank you very much for sharing this. Yes, please, if you will, if you can, if you're willing to take on this, why not? Thank you for today's session. According to Hannah, it's made me think. We anecdotally talk of these multiple fold injustices, but this is a tangible measure. Brilliant food for thought. I'm eating meal hands now. Okay, no problem. All right, Charlie, any more questions from the group? It's 8:05. Are we still on time?
Yes, yes. We're still on time.
Okay. What about the others? We think I really like the discussion going, especially with Mo's perspective. And yeah, many work to be done. Anyone else? I think we can still have one more from our other participants. Oh, I know somebody here. Aya. Is this Aya Medina from Pampanga? Aya, are you there? Is Aya here? Okay. Ako, wala yata. All right. Okay. Any final thoughts, Charlie, before
Yeah, so
I end?
basically it was really an interesting discussion. But just to cap up the questions, I think is if you could actually share, Dr. Mike, about some of the impact of actually utilizing this OJHQ tool, and I think this is a little bit related with your PhD, and how would be the data or the information that are going to be get that are got from the OGHQ utilization impact changes in the what are the outcome measures eventually, or the impact of this OGHQ utilization to the participants or eventually to the institutions that you have worked with OGHQ.
Yeah, I think the outcomes of using this tool in healthcare practice or social care practices. Of course, when we gather more data to this, we can use them to how somehow shape or propose protocols, policies, and even practice patterns in our healthcare to make it more inclusive, at least, and go beyond just gender awareness, because I believe that in the government, or at least in different companies and institutions, we have gender awareness trainings, all of these things. But beyond that, I think we need to move beyond awareness. We need to start proposing solutions that are actionable, that are really being practiced. And I hope that, eventually more healthcare professionals, social care professionals would use this. Again, I agree with Mo that this tool can be used alongside with other existing tools already. That's also what we found in our reflective study. That's also our recommendation, that this cannot just stand alone, but this will add another layer to enrich our assessments and interventions for people, especially who are in the marginalized sector, including people from the LGBT community. So as I end, thank you, Charlie, for that. As I end, some concluding notes. In our OJHQ study, we found that there is an expansion of the purpose from just recognizing injustices in everyday practice. We also found that using the OJHQ can enhance the clinical reasoning and the ethical reasoning of practitioners. Kasi it's not just, you know, a black and white thing when you talk about injustices. So it really makes practitioners and even students think critically. Promote justice-oriented healthcare, activate reflective practice, because, you know, when we were using the OJHQ, it really made us think of a lot of things like, oh my, we never thought of this before. But once we use that, we heard stories, because the questions and the constructs, the concepts that we are asking in this tool are really not being asked in a normal medical questionnaire, correct? So when you start asking these questions, then your reflections are activated. And of course, to recognize the interweaving and evolving nature of injustices. Like I said, injustices tend to mutate from one setting to another, and that's something that we need to really take in seriously, creating actionable outcomes and actionable solutions to reduce or even eradicate this for people. And also, our study revealed how reflections can facilitate cultural adaptation of practice tools used in OT and justice health practice. I think this is related to the question of Mo, because normally when you do tool adaptation or questionnaire adaptation, you usually use quantitative measures to validate or check the reliability of a certain tool. But we'd like to argue that if you have a tool such as this that contains qualitative questions and would expect qualitative responses, we feel that reflections or reflexive study methods can be useful to also provide cultural adaptation to certain practice tools, aside from, you know, the normal statistical studies or psychometric studies. So that's it. Thank you so much for that interesting workshop. We really enjoyed this, and we will keep all your suggestions in mind as we continue. Let's keep in touch. You may email me in my email address at mpsy@up.edu.ph, or you may follow me in my social media, Mike C. So we can keep in touch, all of you. I know Hannah is on Twitter, so I think I'm following you on Twitter already.
Yeah.
Yeah, so thank you very much.
Thank you so much for everyone. And of course, before I actually provide a certificate of appreciation to Dr. Mike C, I just want to commend everyone for participating actively with this workshop, and of course giving some insights, because I think OJHQ is a developing tool eventually, and it's a promising tool that actually uncovers not just clinical or non-usual ideas in occupational therapy or occupational justice work. And at some point, it's something that we should be gearing towards as we go on population-based practices and community-based practices. And you have the access to the Google site, and I'm hoping, and I feel like Dr. Mikey would be happy to have you interact with that one and utilize it eventually for more collaborations and so on. I think you can contact Dr. Mike C and his team in providing OJHQ and further develop that tool. Okay, so thank you everyone.
Yeah, thank you, Charlie. Let's take a photo. We'll put this in the resource site.
Yeah. So if I would request everybody if they could actually open their cameras, that would be very
Yay!
helpful. Okay. And
Thank you for joining, even if you're in the hospital. Thank you.
Okay. So let's take a photo first. Okay.
Charlie, let's take photo.
Okay.
Thank you. Ready?
Smile, guys. 1, 2, 3. Okay. Thank you so much. And of course, I would never forget. Okay. Cha, can you share your screen?
Which one?
With Cha. Okay.
With Cha.
So,
Okay.
yes. To give you the certificate of appreciation, to cite the Global Assembly on Everyday Life, Gender and Sexuality presents this certificate of appreciation. This certificate is presented to Dr. Mike C. in grateful appreciation for being one of the workshop facilitators during the Global Assembly on Everyday Life, Gender and Sexuality, organized by the UP Manila Center for Gender and Women's Studies in partnership with Section OTOS, held on October 29, 2/30/2021 via Zoom, signed by yours truly, Rochoy de los Reyes, and of course, Dr. Leilani Apostol Nicodemeos. Okay, so thank you so much, Dr. Mike C, for that very good workshop. And just to remind everybody, we're going to have our closing ceremonies at around 8:30 in Manila time. So Cha would be sharing with you the link for that closing ceremony. So the announcement of the winners for the parallel sessions and of course the film competition. If you haven't watched it, it's all embedded in the website. So it's going to be a very good event. So have a break. See you at 8:30 Manila time. Okay? Thank you so much.